My friends, it's Sam Collins, the coding and billing expert for acupuncture for you, the profession, and of course, the American Acupuncture Council. And thank you for spending some time with me. This is an important time of year because here's a riddle for you. When do the 2025 diagnosis begin? Now, the quick answer to that riddle might be, well, Sam, you said 2025. It must be 2025. Actually, it's not. The 2025 diagnosis codes, as they do every year, actually update the October 1st before. So the answer to the riddle is the 2025 diagnosis began October 1st. So make sure that if you're using one of these codes that I'm going to go through, to update your list to make sure you're using the most current code for your patient. Because if you use an old code, it's going to be denied. Now you can see here, or in fact, let's go to the slides. Let's go to the slides. Let's look at it. So the update you'll see here is the 2025 update is October 1st. You can see there's 74,000 diagnoses. Now let's be realistic. Is an acupuncturist going to ever use anything like 74,000 diagnosis codes? Of course not. However, a lot can be covered because acupuncture, of course, for pain and pain management has a lot of ways of being coded, but you'll know one of the most common things you're billed for or paid for, I should say, is back pain. In fact, that's the code that made the biggest change for you. But let's keep in mind how these work. The date of service determines the code. So let's say, by example, you're billing a patient that you saw in September of this year, but you're sending the bill in December or January for that matter. It's being a little late, but you're still sending. It doesn't matter when you send the bill. The date of billing does not affect the code. It's the date of service. So if the date of service was prior to October 1st, please use the old code. If the date of service is after, use the new code. Pretty straightforward and simple. However, let's talk about what if changed. The changes are occurring for lumbar and lumbosacral discs. Now, as an acupuncturist, you might say, well, Sam, I'm not sure that's very important to me. Well, certainly it could be, as a lot of acupuncturists now are working as the referral person for back pain and pain management for medical doctors. You're often going to get patients that will have these conditions, and often they're not going to put a code for you. It's just going to say disc degeneration. Well, right now the code is M5136, so pretty straightforward. M5136, that's fine. But here's what's changing. The changes now, they're going to be a little bit more granular or more specific, where it allows you to kind of describe what's going on with the person. You'll notice this first code, M51360, is disc degeneration to the lumbar region with back pain or discogenic back pain, meaning back pain. So that's pretty straightforward that it is back pain, of course. However, could there be more? Well, there is more. M51361, other intervertebral disc degeneration in the lumbar region with lower extremity pain only. Now, notice there now is a code that is back pain only or one that's lower extremity pain. So many times a person will have disc degeneration and go, man, my leg is killing me. And it's actually from the disc. So now there's a code to differentiate that, but there's also one when it's combined. So if you have a patient with combined back pain and leg pain, there's now a code M51362. Clearly, a person with back pain and leg pain a little more severe, of course, meaning more care long term. So this really, I think, sets up to demonstrate the length of care someone is likely going to need based on a diagnosis. Now, we have back pain, leg pain, and a combination of both. But there's always this one too, and I'm sure you've seen this. There are many people that maybe they went in for some upper back issues, but they did an MRI or X-rays to other areas, and they found, oh, there's disc degeneration in the lumbar spine, but it's asymptomatic at the time. If there's disc degeneration that's asymptomatic, there is now a code. Disc degeneration without mention of pain in the back or lower extremity pain. I like that. That kind of lends to, that doesn't mean the person is fine, but it does mean that they're obviously having disc degeneration and we know they're going to be closer to having a problem. So what this does is just add a little more specificity. If you were seeing these codes, please make sure to add these new digits to get that specificity for it. Because if you send an M5136, it's going to be rejected, unless, of course, it was before October 1st. They've done the same thing for lumbosacral disc. There's M5137 lumbosacral disc, meaning L5S1, but you'll see it's the same protocol with back pain, with lower extremity pain, or a combination of both. So just making sure no longer now is it just one simple code, but there's going to be three codes demonstrating when it's hurting, or one if there's asymptomatic. Now you might think, well, Sam, I don't know if that's significant to me. I'm an acupuncturist, but if you think of it, how often do you treat people with chronic back pain? That often could be disc related. You may not be making that as the primary code, but if it's on the claim, we better make sure we have the right code to it. Now, one thing to keep in mind though, let's say you're coding someone with back pain, just plain back pain. You cannot use a back pain code with a disc code. So never combine like an M51 series like lumbar disc or lumbosacral disc with a pain code. In my opinion, obviously you're going to use the disc code. It's more severe. I mean, think of if you said someone has back pain compared to saying discogenic back pain or disc causing leg pain, I think you'll see the severity levels a little bit higher, probably longer term care. Bottom line, I want to make clear though is don't combine them. If you say, Sam, I don't want to use a lumbosacral disc code, I would say, why not if it's already been coded for you? But if so, make sure not to combine it with the back pain codes. And let's keep in mind, back pain codes updated. What is that, 4 years ago now? However, I want to make sure it's clear the back pain codes are M5450 for unspecified low back pain. We have M5451 for vertebrogenic low back pain. And then we have M5459 for other low back pain. You might be thinking, well, Sam, that's not new. Why are you updating it? Because this is a problem I see. Obviously, many acupuncturists now are beginning to access particularly Medicare Part C plans. These are your Medicare Advantage or private pay insurance plans that many will have direct access for acupuncture, not needing an MD. When you have a plan like that, do not use M5450. Please make sure you're using M5451 or M5459. If you use M5450 for the Medicare plans, it's going to reject it. So keep in mind M5451 or 59. My opinion, M5459, best choice. Other means something that you can name or the reason for it. It could be pregnancy related for that matter. Bottom line is no pain codes with disc. If you're coding disc, here's what I'll tell you. The association is kind of, it's already there. Now you can see there is a code that says no pain, but in other words, don't put pain with it, but one or the other. Now, there's some other codes that are musculoskeletal related. And you might look and go, well, Sam, I don't know if I'd ever use this. And I'm going to say these aren't probably common, but I want to make you aware. Because as you can tell with diagnosis, they're commonly looking to update and make things more granular, more explained, if you will. So currently we have a code that just says synovitis, tenosynovitis, unspecified. And that's basically your tendonitis codes. Well, here's what we have now. Codes that are specific for these conditions that are going to each area: shoulder, arm, forearm, hand. So everything upper extremity. In addition, lower extremity. So you'll see here thigh, lower leg, ankle and foot, and so on. The idea is that coding is always there to try to give us our best way of describing what's going on. At the same token, don't be afraid to be simple when it comes to acupuncture. Often a pain code is going to be your best bet. However, when I can have something more granular, I like it. Think of disc degeneration with pain compared to just back pain. I think we see two different things there. But also know what the carrier requires. So by example, if you were billing Aetna, even though they may have a disc issue, you're going to code it as pain because that's what they accept. Cigna Insurance, Anthem, others will accept the disc degeneration, so kind of know which plans you're dealing with. As always, the American Acupuncture Council is here for your help. I run our network. The network service is we do seminars and we do one-on-one help. That's really what we do. If you want to make an expert part of your team, take a look at our site. Take a look at what we offer. We give you 2 CE seminars a year, plus unlimited access to get with me so we can go over everything in your practice. What are your fees? Are you billing the codes properly? How do you document? How do we make sure we're getting paid? We always want to make sure you have success because your success is ours. Until next time, my friends.